All right, so I have an order to give my patient 2 different injections, and first thing I'm going to do is I'm going to check my MAR against my physician's order, okay? I'm going to check it for the client's name, the actual medication, the dose, the route, the time I'm supposed to give it, and the date of the order. And I also want to check for allergies here and again at the bedside. Okay? So the first thing I need to do is pull my supplies. All right, so I am given a sub-Q injection of heparin. So I want to make sure I pull the correct syringe and needle. All right, so this is sub-Q. Since my order for heparin is I'm given 5,000 units of heparin. 5,000 units of heparin. My available is 10,000 per ml. So I'm only giving 0.5 of heparin. Okay? So I need to verify that with my vial. I'm going to make sure it's the correct medication. Make sure it is not expired. So I have my heparin. I am going to, this is the needle that I'm going to connect afterwards, okay? So I have a 23 gauge 1-inch needle, all right? That's a sub-Q injection. But to draw it up, we're going to use the blunt tip for the medication, all right? So we're going to do one at a time. So this one right here, I can use this syringe. It's a 3cc, which is the smallest syringe for a sub-Q, other than a TB syringe, not insulin, but TB. I can use this for a sub-Q. This right here is really good if you're given 0.8 of something, anything less than a mil. So I'm going to go ahead and use the 3cc syringe. So I'm going to take my blunt tip. I'm going to attach it to the syringe. All right. So if this was a new one, you're going to pop off the top. Go ahead and still clean the top. All right. So if I'm giving 0.5, I'm going to disconnect. I'm going to pull up 0.5 of air. Okay. I'm going to inject that into my vial. Push the air. I'm going to come back here. And I'm going to actually go past 0.5 to make sure. You can always do this to get your air out if you have any. But I'm going to push up till I get to 0.5, which is what I'm giving. Okay? So, all right, so we went a little bit beyond. See, things like this happen. So, I actually cleaned it again because what it was the pressure in the vial. Okay, so we're going to try this one more time. We're going to disconnect. Okay, so I actually got more this time to make sure. So I'm going to, in a sink, I'm going to push, get all the way up to 0.5. And that's where we're supposed to be, correct? Okay, so this is what we call the one-hand method. If you want to recap, and you only do this when you are in the med room, not at the bedside once you've given an injection, never recap. All right, one-hand method is the scoop. I'm going to push it up, snap it. I'm actually going to take my actual needle we're going to do. If I can find where it opens. Maybe. Maybe not. Okay. We're going to disconnect this. Put our clean needle. Take this off. This goes in the sharps. That goes in the garbage. Now, this has to be labeled because I'm going to this room with 2 medications. So I already labeled it with heparin, 5,000 units for room 201. We're labeling this syringe. Okay, so that's one I have ready. My next one is we are given Rocephin. This is going to be an IM injection. My site that I've chose is the vastus lateralis. Okay, so I will show you that when we get at the bedside. The Rocephin comes available in 250 milligrams per ml. My order's 500, so I'm going to have to draw up 2 mLs. All right, so I have my Rocephin. All right, I'm given 2 ml, so I chose the same syringe, a 3 cc syringe. The first thing we're going to do is connect it to a blunt tip to draw up the medication. The actual needle that I selected for an IM is a 22 gauge, 1.5 inch. Okay, that's what we're going to use. That's the appropriate size for an IM injection and for the size of my patient. All right, so I'm going to clean. This is glass. In the hospital, you will have to take this with you, okay, to the room because it has to be scanned. Otherwise, it goes in the sharps because it's a glass container. All right, so this is my Rocephin. I verified the name. I verified that it's not expired and the correct dose, which I have to draw up to. So I'm going to clean the top. All right, so if I'm giving 2, I'm going to draw up 2 milliliters of air. Okay, I inject it into the top, which is right in the center of the rubber stopper. All right, then I'm going to turn over and I'm going to draw up 2. Get the air out. All right, so you can always go a little past, so you can push up to 2 and make sure all of your air is out. Okay, so I'm going to disconnect. I have 2 cc's of medication. I'm going to do the one-hand method, snap it. I'm going to take the needle I'm actually giving the injection with. I'm going to disconnect this, connect it to my syringe, sharps container. Garbage. All right, here is my label with Rocephin, 500 milligrams, and my patient's room number. All right, so now we have our 2 syringes. We're going to head to the patient's room. Make sure you have gloves and alcohol preps. Okay, so we're going to head to the patient's room. All right, so the first thing I'm going to do is I'm going to knock, and I'm going to say, "Hey, Miss Jones, my name is Shay. I'm going to be your nurse today. Can you tell me your name and date of birth?" And then I'm going to verify that against my patient's armband as well when they tell me. Okay? Then I'm going to explain to them what I'm giving. Okay? So I'm going to let her know that I'm giving heparin, which is a blood thinner. So I want to make sure she has no bleeding contingencies or anything like that. That is called a contingency for that medication. As well as I should have checked the PTT at the desk in the labs with my physician's order. The other one is Rocephin. The biggest thing with Rocephin is it is an antibiotic. You need to make sure they are not allergic to anything, especially in the same family as Rocephin. So, all right, so the heparin we're going to give in the abdomen, okay? It needs to be 2 inches from the belly button, and it can be anywhere around the 2 inches. Make sure the sites are rotated. If someone gave it in the left upper, let's do the right upper today, okay? So, this is my abdomen. So, once I got in the room, the first thing I did when I walked in the room was wash my hands. Or use the foam, as we always say. Before you give an injection, always put on gloves, okay? because you can always come in contact with bodily fluids when you're given an injection. So, all right, so this is my abdomen. I'm 2 inches from the belly button. Okay, I'm going to start in the center, and I'm going to clean in a circular motion, and then we're going to let it air dry. Okay, heparin being a sub-Q, I can give it at a 45-degree angle or a 90-degree angle. If you have, your patient has plenty of sub-Q tissue, you can go in straight at a 90-degree. Okay, this patient has some, but we're going to do a 45-degree angle, which means you need the bevel up. Okay, so I'm going to pull this back. That's my safety. I'm going to pull this out. This is the bevel. Bevel up means this part is facing up. Okay, so this is also a sub-Q injection. We do not aspirate and you do not massage, especially because this is heparin. You don't massage with heparin, Lovenox, or Rixtra. They are all blood thinners. Okay, so we've cleaned the site. It is air dried. I'm going to pull up, kind of pinch up the skin. All right, bevel up, approximately a 45-degree angle. I'm going to inject. All right, I'm going to give my medication. I'm going to pull straight out, let go. This is the safety. Click it. Okay? Don't walk across the room till you click it. They all should have a safety device. So, now that it's clicked, this will go in my sharps container. Okay? The other injection I have to give is Rocephin, which is an IM. All right? IMs are at 90-degree angle, and you do aspirate with an IM. All right? Most IM medications, you need to use the Z-track method. All right? Definitely this one, because Rocephin hurts. But we verified our patient is not allergic. Now, the site I've chosen is the vastus lateralis. So, if you were to get your landmarks, you take a patient's leg. Right here, you're going to make a box. You've got 3 lines, 3 lines. I'm going to choose the center outer quadrant to give my IM injection. Okay? If it was 1 mil or less, I could use the deltoid, or I could also use the ventrogluteal, even if it was less than 1 mil or more. Okay? But this is my site, so we're going to give it right here in this middle outer quadrant. All right? So I've got my site. I'm going to clean it, start from the center in a circular motion. Okay, we're going to let it air dry. All right, so we're going to take this, pull off our thing. We've got the 2 mils that we've already drew up. This is a 90 degree, so it doesn't matter if the bevel's up. All right, so Z-track, I've cleaned it here. I'm going to start here and pull the skin to the side. Okay, I'm going to go straight in at a 90 degree, straight in. I'm going to stabilize my syringe. I'm going to aspirate, which means you pull back. If I do not see blood, I inject all of my medication. I'm going to pull straight out and let go of the skin. This is a different type of safety. This one, instead of clicking it, you push up. Okay? Now I can walk across the room to my sharps container and dispose of this. Okay? So, I'm going to check my patient, make sure there were no problems. I'm going to dispose of my gloves. I'm going to wash my hands, make sure my patient does not need anything. And then I'm going to go back, document on my MAR, and if there were any problems, I would document that appropriately as well.